Hello and welcome back to Health After 60. Today we're discussing 5 common habits that doctors wish seniors would stop. As we age, our bodies change, and what we could get away with in our 30s or 40s can have major health consequences after 60. The good news is that changing a few key behaviors can dramatically improve your quality of life. In this video, we'll outline 5 habits doctors warn older adults about, explain why they're harmful, and offer practical steps to replace them with healthier routines. As always, talk to your doctor before making changes to your health routine. 1. Sitting still. Stop leading a sedentary lifestyle. One of the biggest concerns doctors have for older patients is physical inactivity. As muscles and bones naturally weaken with age, staying sedentary accelerates the decline. The National Library of Medicine's Medline Plus notes that adults should aim for 150-300 minutes of moderate intensity, aerobic activity, or 75-150 minutes of vigorous activity each week, and include strength training exercises 2 or more days per week. For older adults, combining aerobic exercise with strength and balance training helps maintain stability and prevent falls. Why does sitting matter so much? Lack of movement leads to muscle atrophy, joint stiffness, slower metabolism, and weight gain, which in turn increases the risk of heart disease, diabetes, and cognitive decline. Even short bouts of movement throughout the day help. Walking to the mailbox, gardening, or dancing count. If you can't meet the full 150 minutes right away, break it into manageable chunks. 10 minutes of brisk walking 3 times a day adds up. Incorporate strength exercises like light weights, resistance bands, or yoga to build muscle. And include balance work such as standing on one foot or heel to toe walking to reduce fall risk. Doctors urge patients to start slowly and consult their healthcare provider to choose safe activities. 2. Overmedication. Stop taking multiple drugs without review. Many older adults live with several chronic conditions, and it's common to accumulate prescriptions over the years. The National Institute on Aging warns that polypharmacy, taking multiple medications, raises the risk of adverse drug events, dangerous interactions, falls, and cognitive impairment. According to their research, more than 80% of adults in their 60s and 70s take at least one prescription drug, and about 1/3 take 5 or more. The U.S. Food and Drug Administration offers practical tips for medication safety. They advise taking medicine as prescribed, not using someone else's prescription, and never adjusting or stopping a medication without consulting a healthcare professional. Skipping doses or self-prescribing can worsen your condition or cause dangerous reactions. The FDA also stresses storing medications properly, watching for interactions. For instance, grapefruit juice can interfere with some drugs, and keeping a current list of all prescriptions, over-the-counter medicines, and supplements. Bring this list to every medical appointment so your doctor or pharmacist can spot duplicates and dangerous combinations. If you're juggling multiple prescriptions, ask your doctor for a periodic medication review. They may prescribe unnecessary drugs or adjust dosages. Additionally, avoid over-the-counter sleep aids and cold remedies marketed for PM relief. The National Institute on Aging cautions that sleep medicines carry risks and shouldn't be used long-term. Tell your doctor about any side effects and explore non-drug options like cognitive behavioral therapy for insomnia, physical therapy for pain, or lifestyle changes for anxiety. 3. Harmful substances. Stop heavy drinking and smoking. Another behavior doctors plead with seniors to change is the use of alcohol and tobacco. The NIA notes that older adults should avoid or limit alcohol consumption. Aging makes people more susceptible to alcohol misuse, and heavy drinking affects every organ, including the brain. Studies from the National Institute on Alcohol Abuse and Alcoholism show that heavy drinking can lead to premature aging of certain brain regions and may contribute to poor heart health. If you choose to drink, Keep it to no more than 1 drink per day for women and 2 for men, and consider skipping alcohol altogether, especially if you're on medications or have liver or heart issues. Talk with your doctor about guidelines and support if you need help cutting back. Smoking remains a major cause of preventable death. The Centers for Disease Control and Prevention emphasize that quitting smoking has health benefits at any age. Even people who have smoked for decades can improve their health. Quitting improves quality of life, reduces the risk of premature death, and can add up to 10 years to life expectancy. Smoking cessation lowers the risk of cardiovascular disease, COPD, and many cancers. Doctors wish older adults would not assume it's too late to quit. Resources like smoking cessation programs, nicotine replacement therapy, and counseling can dramatically increase your chances of success. Talk to your physician about a plan that works for you. 4. Neglecting preventive care. Stop skipping checkups and vaccines. Seeing your physician only when you feel sick is another habit doctors want to end. The NIA stresses that regular doctor visits can catch chronic diseases early, reduce risk factors like high blood pressure and high cholesterol, and improve quality of life. Scientists have developed imaging and laboratory tests that detect harmful changes in cells and molecules years before symptoms appear. When you skip routine checkups, you may miss the chance to treat disease in its earliest stages, when it's most manageable. Schedule an annual physical at minimum, and follow your provider's recommendations for screenings such as mammograms, colonoscopies, bone density tests, and blood work. Vaccinations are another critical part of preventive care. The NIA explains that older adults are at higher risk of serious illness from infectious diseases like influenza, RSV, and pneumonia, and they should stay up to date with recommended vaccines. The CDC recommends everyone aged 6 months and older get a yearly flu shot. For adults 65 plus, a higher dose or adjuvanted flu vaccine may provide better protection. Adults 60 and older should ask their doctor whether the new RSV vaccine is right for them. And adults 50 and older should receive pneumococcal vaccines to prevent pneumonia. Booster shots for tetanus, diphtheria, and pertussis are recommended every 10 years, and a shingles vaccine is advised for people over 50 to prevent painful shingles outbreaks. Don't wait until you become ill. Talk with your healthcare provider about the immunizations you need. 5. Withdrawing from others. Stop social isolation. Finally, doctors are increasingly concerned about social isolation in older adults. Changes such as hearing or vision loss, mobility issues, or the loss of friends and family can make it harder to stay connected. The NIA reports that loneliness and social isolation increase the risk of heart disease, depression, and cognitive decline. One study of more than 11,000 adults over 70 found that loneliness was linked to a greater risk of heart disease. Another showed that socially isolated older adults had more chronic lung conditions and depressive symptoms. Isolation also accelerates memory decline and can worsen physical inactivity. On the flip side, staying engaged with others has powerful benefits. Research cited by the NIA shows that making new social contacts is associated with improved physical and psychological well-being, and older adults with regular social contact are more physically active than those who are isolated. Doctors encourage seniors to nurture their relationships with family and friends, join clubs or volunteer groups, attend community centers, or take classes to learn new skills. Even a daily phone call can boost mood. If mobility or hearing issues keep you homebound, explore senior centers that offer transportation or virtual programs. And if loneliness leads to depression, seek help from a mental health professional. Support groups and counseling can make a significant difference. Conclusion. Healthy aging isn't just about adding years to your life. It's about adding life to your years. Doctors routinely see patients whose biggest health challenges stem from a handful of avoidable habits. by moving more and sitting less, managing medications wisely, avoiding harmful substances like alcohol and tobacco, getting regular checkups and vaccinations, and staying socially connected, you can dramatically improve your well-being. Don't be discouraged if these changes feel overwhelming. Focus on one area at a time and build small, sustainable habits. Your physician can be an invaluable partner. Schedule an appointment to discuss any concerns raised in this video. Thank you for watching Health After 60. Remember to like, subscribe, and share this video so we can help more people age healthfully. See you next time.